Longevity Plus would like to thank you for joining our webinar today. Our host, Dr. Gary Gordon, is an expert on nutrition, mineral metabolism, and anti-aging. He is a consultant to Longevity Plus, where he is responsible for designing effective natural supplements that help to support optimal health. Today, Dr. Gordon is continuing his discussion regarding his F.I.G.H.T program. At the end of the presentation, he will be taking questions. Please raise your hand using your control panel. You may type your question into the chat box. If you prefer to ask your question live, please be sure that you have the audio capability either using your telephone or your microphone. So without further ado, please join me in welcoming Dr. Gary Gordon.
Welcome back, everyone. Lots of things happen in my life every week, and it's been another exciting week. And I need to make all of you aware that we need to make these webinars a little more exciting by having all of you begin to participate. I see, for example, that NYU Medical Center, which is I really enjoy listening to whenever I'm driving the car on my Sirius satellite radio, they tell everybody you can email in your questions. So I'm going to throw that open to you. I'm gordon@gordonresearch.com, or you can wind up faxing, and the fax number is 480-474 I'll have to come up with it, 3819, 474-3819. The idea that I'm getting at is this. I go to so many conferences. I have been exposed to so much information that I can't make it relevant to you if I just ramble on and tell you how complex things are or how exciting things are, because fortunately there is always exciting things to report on. And at the conference I attended this week for 3 days, which was a lot of fun, it was in Las Vegas, where it's held each year. This was their 30th annual meeting of the American Naturopathic Medical Association. There are 2 different naturopathic associations, and I've known some of these people for years, and we had some great talks. One by Dr. Louis Romero on oral polysaccharides, and a really outstanding talk on energy in the mitochondria and methylation by Jack Tips, and then a talk that really is helping change my life because everybody I meet contributes to my knowledge base. And Dr. Amit Patel, MD/MS, Associate Professor of Surgery and Director of Clinical Regenerative Medicine at the University of Utah Health Care Center, actually has impressed me enough that as a doctor who 99% of the time doesn't send any of my patients to any heart surgeon unless you're talking about a valve, and even on the valves, for heart valve, I put it off because we're pretty successful. When I get you on my K2 and my oral chelation things, I can put off valve surgery for a long time. But I found finally a heart surgeon that is open to all the things that I study, from IV magnesium that he uses during all of his heart surgery, to his strong interest in stem cells and what he's now researching things in lung cancer, and even open to my excitement that I share with all of you about pulsed electromagnetic field therapy. So yes, unless I get questions from you, it's kind of hard to bring in all the latest information to you, because the slides which I show you helps me bring to you enough knowledge to hopefully empower you to challenge whatever you're being told is the condition that you face and what your choices are, because I do second opinion medicine. I do consultations on anyone. It's average in 1 hour. I can do a pretty effective second opinion, but it's $300 per hour, so if you want to go into more depth. But it's important for you to know that whatever your condition is, whether you're talking about your child that may have depression or diabetes type 1 or obsessive compulsive behavior, whatever is going on, I want to make it very clear to you that we have answers. But you see, to protect my reputation, I don't wind up telling you that it's all because you have food sensitivities or because you have Lyme or it's because everybody in your family had diabetes or everybody that you're a dentist and you're working with mercury or you're past the menopause age and you got hormone issues. I try to cover you by letting you know that if you fix any of these areas, if you got all the toxins out, a lot of the other things tend to correct themselves. To prove that to you, a recent study has shown that if you have a brain tumor and you want to compare what's going to help you the most, surgery, radiation, chemotherapy, or actual exercise program, what do you think the proven answer was? Exercise won, hands down. So you say, how could I be exercising if I have a brain tumor? Well, what I'm letting you know is that there are people who in the early stages of their disease can really get serious about exercise. And when you can't, I can always use pulsed electromagnetic field therapy, and I can actually exercise your brain or your eye muscle or your hearing or your pancreas or your toe with PEMF. Now, to try to keep you really focused where I am really a crusader then in alternative medicine, and my job is to try to have you with as accurate information as possible. So I have 10,000 pages on my website, so you never find what I wrote because it's too complicated unless you go to gordonresearch.com and you put in the word oral chelation or IV chelation or put in the word EDTA or put in lead or mercury, then you might start to find those pages I put there. And if you're a health professional or you have a doctor that you think is open-minded, any health professional is free of charge, can join my private membership-only school where I have another 10,000 posts that go way beyond what I'm saying on my public site, because my public site is controlled by FDA, FTC. We can't tell you too much, but you can join if you're a health professional, F.A.C.T., and you can see exactly what we do with prostate cancer or autism or Alzheimer's or ALS or MS or anything. But the problem is that if I do a second opinion consultation for $300 on any of you, I assure you, I will bring up issues that you have not considered. And that allows me to look pretty smart, because when I add a little bit more thought to your program instead of just saying, well, you've got inoperable tumor someplace, if I look at, well, what would happen if we get your magnesium levels up? What would happen if I brought your omega-3 levels up? What would happen if I improved your vitamin C? Now, I want you to know that there's a obituary yesterday in the New York Times, August 1, on page A15, Dr. David Servain-Schreiber, that's Servain-Schreiber, is a cancer fighter, and he wrote the book, The Anti-Cancer Diet, along with other books. And it's really nice that at least New York Times treated him honorably, because you see, this man had his diagnosis of brain cancer at the age of 31, so he dies at age 50. That's not bad, folks, but as a trained neuroscientist, he is as dumb as all the rest of us, and he had to do the nonsense that everybody else does until it failed. So he wound up having surgery, and the tumor came back 5 years later. And then he went through the chemotherapy, and he had a second operation, and he had radiation, and all of that failed. So he wrote a book, The Anti-Cancer, A New Way of Life. Now, my point to you is this. He then did what most of you are going to take. I mean, because it's so frightening when you have a nasty diagnosis, it's pretty easy to take what's covered by your insurance and let them give you the chemo and give you the radiation unless you know your facts. If you knew your facts were that exercise beat all of those in the case of a brain tumor, and now they're putting electricity right into the brain, and I'm using pulsed electromagnetic field. But PMF is just another way to exercise cells. And if you exercise a cell, it's going to start moving its toxins out and taking nutrients in, but it does much more. All cancer cells have low transmembrane potential, and that puts them into the anaerobic acid metabolism. And we do know that Otto Warburg got a Nobel Prize for saying that cancer only grows in these acid and anaerobic conditions. So we can change all that, and it's important for you to then know that the omega-3 fatty acids and all the acupuncture and all these things, which we call natural approaches, are really documented then to beat, because remember, this neuroscientist did what mainstream medicine would have him do. But after it all failed and failed again, he then at that late stage then started to look at a new way of life, and he wrote a book about it. The benefit of a healthy diet, a balanced lifestyle, nutrition, exercise, emotional well-being, environmental awareness, eating anti-cancer products like vegetables, olive oil, garlic, green tea. Anyway, I want you to understand that I've come back now time after time to my F.I.G.H.T program in an effort to make sure that you actually digest what it's saying. If I tested you adequately, any one of you will fail an infection test. I give you a written guarantee. And that, we may spend $5,000 or $10,000, but we'll find Lyme or Candida or cytomegalic virus or chlamydia. We'll find infection in you. So if I'm a world expert on infections, whether it's a parasite or something, I treat that. I can assure you that that's like exercise. It's going to help everything else work better. You'll be less sensitive to foods. Your genetic picture won't be as expressed. What do I mean by that? If you have the BRCA1, BRCA2 problem and you're being told you need both breasts removed and the ovaries out, my point to you is that we proved with Dr. Kobayashi in Japan that when I improve your environment, your diet, your stress level, get you lower stress, do some more sleeping, all the other things, get some of the toxins out, spend time in a far infrared sauna, do some immune support, then, amazingly enough, in 10 years, none of the patients died of cancer. So we're pretty confident that I'm not wasting your time when I try to tell you that genetics is a very interesting story, but there's a great, really, story here that you're not being told. And that is, no matter what the bad genetic issue you carry, even if everybody in your family had gastric carcinoma and you have the gene for it, in Japan we proved that if you follow the program I am talking about here, it was Kobayashi's program, but my F.I.G.H.T program is the American version of Dr. Kobayashi's World Without Cancer. And to understand what I just said, go to my website, put in the word cancer. When you see the word Kobayashi, World Without Cancer, read the report. Because what I'm teaching you is that, yes, we all have genetic issues, just like we all have infection issues, and we all have heavy metal issues, and many of us, most of us, have some food that's helping kill us. Not just the gluten that we're all talking about today or the dairy products. It can be, some of us, unable to handle healthy food, even a carrot. Of course, who knows if the carrot is healthy? Who knows how it was raised? And today, with so much genetically modified food, things get complicated. But this simple slide from Nova, called Ghost in Your Genes, proves something I want you to understand. I was really excited when Jack Tips gave a talk at the conference this weekend on methylation. And he tied it to mitochondria. Big words. Who's going to work with methylation and mitochondria? Well, mitochondria means essentially the motor in your cell. And a heart cell may have at least 200 of these little motors. They may have at one time, your mitochondria may have been free-living bacteria. But today we understand that just like you want the motor in your car working well, we now understand how to keep the motor in your cell working well, and that ties to getting the toxins out and the nutrients in. But methylation is kind of like oxygen or water. It's a really basic thing. It's carbon and 3 hydrogen. But when I give you vitamin C, I always give it to you in a vitamin C delivery system called Bioenergy C. So that way, this vitamin C we call Bioenergy C will do something for your body that no other vitamin C does, and we can prove that. Because I put in trimethylglycine and methylsulfonomethane and ribose to make certain things happen. Well, Dr. Jack Tips was really talking about these mitochondria and this methylation story, and here you have Dr. Randy Girdle at Duke, and he's director of the epigenetic. What is epi? That means above genetics, so maybe this is even more important than just studying genetics. This is above genetics. And what he showed is that if you take mice and you warm their food in a microwave, in a piece of plastic bottle, that plastic bottle can put enough bisphenol A, the hardener in plastic bottles, into the water so that that lean, healthy brown mice that have never had diabetes becomes diabetic, they turn yellow, and they become obese. And that's all because of exposure to something that you and I are exposed to every day. We thought drinking water out of plastic bottles made sense. And to an extent it was. You were trading one poison for another. So what are we going to do about it? Well, as he proved, that once this problem has happened, all the offspring of those mice will always be diabetic. So here's lean brown, and here's the unhappy, fat, diabetic, obese, yellow mouse. But is there any way to bring it back? Can we ever stop so all of its babies don't have to be the same fat, unhealthy diabetic? And the answer was yes, when we did enough methylation support. Now, where are you going to get methylation support? Is it you pull into the gas station? No, you wind up taking supplements. Some of the supplements need to be things that I include in the vitamin C delivery system, which we call Bioenergy C. That's why it's the most expensive vitamin C on the planet, because it has in it all the stuff to make it work and do what no vitamin C has done for you otherwise. So what we want you to understand is that when I give enough of the methylation support, as I can do when I also include something like Beyond B12, a sublingual tablet that you can take, and it has in it 3 forms of folic acid. Why 3 forms? Because no one form can meet all of the needs of your body today because of the methylation defect that all of us carry from this careless poisoning of the American population by the plastic hardener. So if you look at this genetic and you see the word DNA methylation and obesity, you begin to get an idea that what I'm telling you about will help with heart disease, diabetes, obesity, cancer, etc. So that's why I keep coming back to my F.I.G.H.T program, because only by having you aware that everything behind ill health is multifactorial. So if you hear a lecture on mercury, the guy's right, and if you hear a lecture on candida, he's right, and if you hear a lecture on the need for methylation support, they're right, and the need to get out the dioxin and PCB and other toxin that's in your body, everybody's right. Or the need to get out of the house and walk around the block and exercise. So that's what makes it difficult, because then you can sit there and say, well, I walked around the house on a block and I don't feel any better. Yeah, because we didn't do very much about your lead and mercury. We didn't look in your mouth to find out how many mercury fillings you've got, and we didn't try to help you find out, do you need to go on a gluten-free or dairy-free diet? There's a lot to this problem, but we are all so sick as a population. I know of so few people who exude the kind of health that I want all of you to have, that I think it's worthwhile staying with our learning and realizing that Western medicine has its place, because a lot of people can't be bothered. They're not going to give up their Pepsi or their alcohol or their cigarette. They're not going to walk around the block. So yes, Western medicine has to have something, drugs, surgery, radiation, they can offer you. But those who want to live a long time, and I'm at age 76, I'm feeling pretty young, and I'm thinking 86, 96 sounds very reasonable to me because it took so long to learn something on this world. So if I have all of you understand that, yeah, you are toxic, and yes, you have heavy metals, and you had them the day you were born. You were born because, unfortunately, Mother Nature thinks the mom is more important than the baby, so Mother Nature lets the mom get rid of toxins by concentrating them in the baby that's forming inside of her. So when we take the average baby, we can find that there's at least 230 dangerous chemicals in virtually every baby, and some are carcinogens, some are neurotoxins, some of them are endocrine disruptors, but I'm just trying to have you understand what's going on. Now, if I was lucky enough to have treated the mom during the pregnancy with all my magic, we can dramatically change that, but I can't prevent it all, because every time you breathe, you're taking in more lead and mercury and cadmium and arsenic, because when we burn coal in China, so they can have their electric lights, and they're entitled to have that, they have to put up in the air some bad stuff from the burning of coal, and it does settle on America, so that at Mount Washington in our continent, we have provably the birds loaded with mercury, and all the food that they try to eat, the plant life they have, is coated with particulates which came carried on the jet stream. So yeah, we have detrimental health effects, and early environmental lead and mercury is all part of the program. And when you put all these together, sure, it's logical that the body might slide into an overnight gene change so that all of your offspring could be diabetic. And certainly the way things are looking in America, that doesn't look too outlandish. Now, in the bottom line, I tell you about Quinton marine plasma. Now, most of you don't know what that is, but it's ocean water that's very sophisticated, but it brings to you cesium and rubidium and gold and so it has in it all of the ultra trace minerals from the ocean. And when you have these, it's another way of trying to keep the cells alkaline. When the cells are alkaline, the red blood cell releases oxygen more effectively, and if you have a lot of oxygen in an alkaline cell, that cell can start to go back to healthy metabolism, not anaerobic fermentative metabolism, which is what's going on with your cells. And if you happen to be lucky enough to find a doctor in your neighborhood or a clinic, or I think they have the spas one day will have these electromagnetic fields, so that you won't wind up having to have 2 and 3 people get together and lease one for $480 a month. The day's going to come, we're going to see that since the Earth's magnetic crust is gone, the magnetic energy that we need is at 1% of what it was, or less. So with that said, then the cell membranes, which of course membranes are made out of healthy fats, which is why my oral chelation gives you primrose and omega-3. That's 9 pills. For me to cancel your bypass surgery, you have to be for life on my 9 pills, which we spent $10 million figuring out how the 9 pills would work nicely without any statins, no aspirin, no Plavix, no Coumadin. You wouldn't have a blood clot form, and you wouldn't have a heart attack or stroke. We've been pretty lucky with what we've done. We've certainly cut down so that I don't get phone calls at this office from somebody who buys BCI and get 2 phone calls. We haven't had 2 phone calls in 30 years of somebody who's been taking the 9 pills twice a day and has a heart attack or stroke. So we think we're on something pretty smart. But understanding it all, because you're still stuck with Alzheimer's. When's that going to hit? I mean, how many times have you walked the kitchen and you don't remember why you went there? Because you see, Alzheimer's is kind of a phony name. It is really, according to the top director at NIH, who's a well-recognized MD, PhD, Alzheimer researcher, he says there is nothing called Alzheimer's. It was a way we raised money. So if there isn't something called Alzheimer's, what's all these people who can't know their name? What's that all about? Well, it comes on early because somebody hasn't learned my F.I.G.H.T program. They haven't stopped eating that wheat that doesn't just give you an irritable bowel and diarrhea and cramps. Wheat can also destroy part of the brain if you have what we call celiac disease, and you have this advanced, serious autoimmune disease, which is part of what the gluten story is about. But if we have you really get to understanding, we can stop your aging. We can reverse aging. We can take people who are getting so confused, you're afraid they're going to have to be let go at their job. But if they will be willing to take an advanced program that I will recommend, they won't wind up having to be let go at their job, because they will be able to come back. The body is extremely resilient. But we have to deal with the folate. We have to give people the vitamin D. We have to do all the things it's involved in. It really is more a question today of how to maintain your health with a program that addresses F.I.G.H.T. And that does sound like a lot of work. And so a lot of people are going to ignore it, which is fine. And then they'll wind up with some problem, because you can't just assume that you're going to live forever. At some age, either brain disease or cancer or heart disease is going to raise its ugly head. And at that point, you're going to sit there and think, well, okay, I got away for years and I didn't have to spend any money taking vitamin C and I didn't do any exercise. But maybe it's not too late. That's what's amazing. The body's so tough that you would think that after you've ignored your body and have not met any of its needs, you'd say it's too late. Just give up, move into the old folks' home, sit there and wait to die. No, it's not too late. We see amazing things. But what we want everybody to understand, taking the vitamins and minerals that I recommend does get a little pricey, but we have good research to explain what it's doing and how. Folic acid. Folic acid, what do you know about folic acid? Well, we have a 5'-methyl tetrahydrofolate. You didn't know that one. And that's the only one that you really can use effectively if you've got a little exposure to drinking water out of plastic bottles or other sources of the bisphenol A, which everybody has. Remember, if we measure the phthalates, that's the plastics themselves in your body, in your bloodstream, they're about 10,000 times higher than they were 10 years ago. So I don't have to look very far to prove my point. But who cares? I mean, as long as your life goes on, let's not pay attention. But what I want is to say that we know folic acid helps prevent birth defects, but we now know that folic acid does much more when you get into the very advanced forms of folic acid and support it with the B12, which doesn't absorb well unless you put it under the tongue. So we sell our Beyond B12 sublingually, and it's part of my anti-aging program along with my power drink, my zeolite, my oral chelation. It's expensive. Who wants to do all that? Well, let's just look at what our choices are. If we can afford that and drive the same car for 10 years and watch the same television set for 20 years, we might still be ahead of the game. So methylation support is where you get the methylsulfonomethane, the trimethylglycine, and we get the methyl form of the B12 and the methyl form of the folic acid. That's 5'-methyl tetrahydrofolate. So that's a lot of stuff to learn. But the good news is that it is changing people's lives. So if you put that little tablet under your tongue, and I would recommend many people need it twice a day for a while. And if you see the reason it's called bioenergy C is it's not just vitamin C, it's a vitamin C delivery system where we have MSM, trimethylglycine, ribose, etc. So we know what we're trying to do. But as good as that is, you and I chose to come to Earth at a time when they now say North Pole could become South Pole, and there's Earth changes going on. Now, those Earth changes don't mean that overnight we're going to be a dead planet like Mars, because when the magnetic field finally is gone, we will be a dead planet. I think we have a lot of time, thousands and thousands of years yet. But it's important to understand that when you are trying to do something with your child that can't learn, and your mom that's getting confused and is starting to not be able to find her way back, and you're afraid she can't drive the car anymore, and your husband's getting high blood pressure and they scare the heck out of him by lying to him saying that you're a heart attack waiting to happen. I want to tell you, nobody's a heart attack waiting to happen when they go on my program. The Beluki, which replaces Coumadin, and the Beyond Chelation Improved, 9 pills twice a day, those two products, they're not going to make you young or live forever, but those two will beat, hands down, anything that any statins or any bypass or stenting is doing for people if you really learn how to read the facts. Because you see, they lie a lot when they tell you your heart attack waiting to happen because my problem is this. The surgery shows that it's hardly any better than the drugs. And so if laying down on the table with a chance of dying on the table is usually not any better than doing drug therapy, and I can show that drug therapy is attacking the wrong monster. Cholesterol is not the monster. It's blood clotting, and I have a natural alternative with the oral chelation-based products with 9 pills called Beyond Chelation Improved. So it's really exciting if we can get all of you to know that pollution is able to be dealt with. I want you to understand what you're seeing here is true. This is what's going on in China. It was so bad that during the Olympics they had to shut down most of the industry because nobody would have stayed for the Olympics because you couldn't breathe. So if you understand that the jet stream is delivering this to you wherever you live anywhere on the planet, then you'll get over this idea that this is, I'm talking to your neighbor or your loved ones. I'm talking to you. Now, we're all different, and some of us can handle these bad things a little bit longer than other people, but eventually the mercury and the ozone and these things, the desert dust, the dust is even carrying all kinds of infections now. So it gets a little frightening, but our body's pretty tough. And all I'm trying to do is teach you how to support your body. So if we look at it, lead poisoning can't go away because we've released so much lead with the industrial age, because remember, lead was heavy and it used to be deep in the soil until we had the industrial age and started digging in the Earth's crust. We didn't move all this lead into our air, and it wasn't in our food and water. But today you cannot breathe any air unless it's been in a special filter. You're not going to find air outside that isn't carrying particulates with lead and mercury. So since the problem's not going to go away, what do you propose to do about it? Well, when I take IV chelation, and I wrote the protocol, and 10 million people have been treated with the ACAM physicians, based on the protocol I wrote some 35 years ago. But that protocol, unfortunately, it turns out, can't have the power to pull the lead back out of your bone. And you were born with 1,000 times too much lead in your bone, according to Caltech, Claire Patterson, and I've discussed this many times. And it's not safe when it's in your bone, because even though your bone takes 15 years to make a new bone, if you're a youngster, maybe 5 to 7 years, but we can have you on oral chelation and the zeolite and my power drink and the exercise and the PMF, and we can beat the game. We can beat the game. Unfortunately, it's a little pricey doing all this stuff. So let's look at the facts. How much money is going to get spent on your health in the last 1 to 2 years of your life? What do you think the figure is? 100,000, 200,000? Because those are figures that are very realistic. Some are spending $1 million in the last 1 or 2 years when their kidneys have finally failed. They don't know their last name, and we're picking up that tab with our country having a little trouble paying all these bills. But if you want to stay healthy, it's possible, but we're going to have to teach people that the lead in the bone only can be handled with a lifetime of oral chelation with fiber and zeolite, because every time you breathe, more lead is coming in. So if somebody tells you it's all hogwash, Dr. Gordon doesn't know what he's talking about, then you have to go back to Dr. Gordon's website, gordonresearch.com, and you have to put in the word lead, and you will find right out of the Journal of the AMA, right out of Harvard School of Public Health, is the study showing that the lead in your bone determines how soon you go blind with a cataract or how soon you die of your heart attack. Well, since it's not convenient to take a piece of my bone, I don't think many of you want a piece of your bone taken just to see how much blood you've got there. Fortunately, Harvard has about a $500,000 device that allows them to measure the level in your bone without taking a biopsy or a bite out of your bone. And so we have all this data to prove that what I'm telling you is all fact. But how can Big Pharma get rich on this? Because oral chelation came out so many years ago. EDTA is totally off of all patents, so they're not going to get rich on that, so they're never going to mention that. They're going to sell you the newest statin. But the statins continue to have this disturbing trend that they're associated with diabetes, and they even think now it could be contributing to some of the problems we have with sexual inadequacy. And there's just a lot of stuff happening. So if you look at the big picture, X-ray fluorescence is where you can get a study done to prove to you that that lead won't leave your bone for maybe 13 years, but you can actually wind up pushing more lead out each day with my power drink, my oral chelation, my high-dose vitamin C, etc. And my power drink has got the greens in it, and it's got the chlorella and spirulina, and we've got the vitamin C and the fiber. It's all there. So this is right out of Harvard School of Public Health, and it's Deborah Schomburg, and it's all published in the Journal of the AMA 6 years ago. And so this is well known, but who's doing anything about it? No, we're just going to operate on your eye when you get the cataract, of course. There's I mean, let's face it, it's the most common operation in America. Who has had their cataract out has ever been told it had anything to do with whether or not they'd been on Dr. Gordon's detox program? Because I just had my prescription weakened because my vision is getting better as I'm aging at 76. But of course, I do all of these things, and now I've even added the pulsed electromagnetic field device, which clearly allows me to exercise my eye or my brain. Because when I use the device, I'm exercising things that we can't exercise by walking around the block. And now I have told you that exercise could be stronger than the treatment available for people with brain cancer, than any of the treatments. So we now know that you're more likely to die of heart disease if you have it, and we do know that if you could keep your blood lead as low as possible, that everything that you die of, whether it's an accident or suicide or shot by somebody, everything that goes wrong in your life seems to be less likely to go wrong if you do like my mom told me when I was a kid. She said, "Son, get the lead out." She was not entirely kidding, because I was pretty tired. I was pretty sick as a kid. I have everything possible wrong with me. I had all my teeth rotted out. There was mercury in every single tooth. I have a genetic inability to absorb food because I have no stomach acid. So now we're doing that to the American public. We give you Nexium, which takes away your stomach acid so you won't have the magnesium or the iron or the zinc, and you will get sick, but at least it stopped your stomach pain. But why is everybody's stomach hurting? Could it be that we have wound up with enough antibiotics in our food supply to disturb the healthy flora, and everybody's going to have to start buying acidophilus? And I haven't found just one kind of acidophilus. I use Acidophilus 9, but there's many out there. I just want one that's stable. I don't want to have to bother to keep it in the refrigerator, and I want to make it work. So I have my power drink with the fiber, which will help the little healthy, what we would call acidophilus, the healthy bacteria, survive by giving them food, which is the right kind of fiber, soluble and insoluble, which is what my Beyond Fiber is all about. So I think I can take the average person and help them stop being so food intolerant. They can stop being sensitive to foods, but that's because I have found a way that is a little easier for me. My friend Dr. Nicholas Gonzalez in New York City, who treats pancreatic cancer very successfully, he has everybody do a coffee enema twice a day and retain it for 10 to 20 minutes. Now, the coffee enema is definitely giving him better success on the pancreatic cancer patients he treats than the people who are being treated at NIH. So those of us doctors who are on the cutting edge, CAM doctors, complementary alternative medicine, alternative doctors like Dr. Nicholas Gonzalez, are doing things that the others aren't doing and giving you answers and suggestions that you're not getting from mainstream. because they're busy. They have only got a few minutes to see you and get you out of the room because they got another patient coming in. So you haven't learned that whatever you're going to die of, whether it's a heart attack or a stroke or cancer or a suicide, is less likely to happen if I can keep your lead levels as low as possible, which is why I have everybody on oral chelation and my Zeo Gold and my high-dose vitamin C, which is part of my power drink, because these things work. Now, Dr. Mark Houston is a really neat doctor, researcher of hypertension research at Vanderbilt Medical School in Nashville. And he's really trying to teach you how mercury and this stuff I've been talking to you about from the burning of coal could be a more logical explanation for why people's blood pressure is going high and why using Dr. Gordon's crazy oral chelation program, getting the toxins out. But today, with the Earth's changes, the toxins don't go out quite as fast as they could because the cells have to have enough energy to push the toxin out. And you measure the energy by looking at the levels of ATP. And that is why I have added pulsed electromagnetic field to my program. How can I help you do it to your program? Well, some of my bright patients have learned, because they've spent enough time on my website, all about what PEMF can do for whether it's cancer, Alzheimer, autism, or osteoporosis, or osteoarthritis, or a painful knee, or painful. They've learned enough that they wound up finding 2 or 3 other people to share the lease, so that instead of spending $480 a month to have access to their own PEMF, they just get it every other day or every third day, and now they're only paying $240 a month, or maybe even $160 a month. So it's very important to have everybody understand that we actually can help you through these concepts. And now I want to leave the rest of the questions. As you know, my oral chelation has got 3 textbooks that back it, and you can buy these textbooks online, and you can convince yourself that even if they can try to convince you that their latest drug is going to be the answer, whether it's Pradaxa, which we have a question about, or whatever, aspirin, because aspirin's such a ripoff. They have such great marketing, but 30% of people on aspirin have no benefit whatsoever. Everybody who is on it, if it was working, it is an antiplatelet. It is not an anticoagulant, and it is definitely able to kill people. About 3,000 a year die because they bleed internally. So you have a risk with it. You have a phony story that it's the answer. I don't mind you taking 2 of them, chewing them when you haven't been lucky enough to be on my program, because if you're on my program, I don't have people rushing to the hospital with chest pain or stroke symptoms. So this is all pretty cool stuff. The Heart Saver program is what we built, the Beyond Chelation, 9 pills. And if you can't find Beyond Chelation, because FDA doesn't allow me to tell anybody on my website, Gordon Research, where to buy anything, so you might have to search for yourself by taking the term Beyond Chelation, improved, and find something. And that's what the 9 pills look like. And you'll see it's got a multiple. It's got a phosphatidylserine ginkgo, and it's got 3 essential daily defense, where we have the garlic and the EDTA and all the magic D-L-methionine is there that helps you detox, and a primrose in order to balance out the omega-3 so that you get the full benefit, because one alone, primrose alone or omega-3, is not the whole answer. Next week we'll get into the hormones, and now we have a great question. How many IVs are usually needed? I've been using up to 16 grams of bioenergy C as well. So let's talk about numbers of IVs. I have been so sick for much of my life that when I saw that chelation was working for me, I could see it on the 8th intravenous chelation. I could see dramatic change. For the first time, I remember my whole life going up steps put me into heart failure. I was so tough I could run right up the side of a mountain wall, and my 2-year-old Irish setter was the one that was having trouble breathing. So the number of IVs needed, I've had over 200 IV chelation, because I can assure you, if I look in any room, anybody who's had 50 to 100 IV chelation is going to look remarkably different to me than the people who have it because I know what to look for. They got a lot of that lead out, a lot of the other bad stuff, and they're having better circulation, they're having better, younger skin, etc. But that's not the whole answer. Because since we now have vitamin K2 that you can buy, and I have everybody who's on my program buys vitamin K2 in addition to the little bit that's in the 9 pills, because we must realize that when you get to 80 and 90 years of age, you can see calcium on the arteries on anybody. You just take a chest x-ray, you can see the outlined arteries that are now hard and calcified. So I have people taking vitamin K2 because I can help prevent that along with my BCI, but how many IVs would you want if you're a cancer patient? Well, you'd like enough IV treatments, such as we do at the Reardon Clinic in Wichita, Kansas, which specialize in the vitamin C treatment of cancer. You would like enough that you are over some of the symptoms that brought you to the hospital, and then you can be on oral program for the rest of your life. And I teach people that, yes, this person is asking about 16 grams. That's a really good dose of bioenergy C. That's 4 teaspoons a day. That's what Linus Pauling was taking, and that's my best recommendation. Although some people, to save money, can wind up getting pretty good results with half that dose, 8 grams, which is 1 slightly heaping teaspoon of the bioenergy C product twice a day, always taken in water or fluid so that when it's wet before you take it, just like my Zeal Gold form of zeolite, the capsule has to be opened and put in a little glass and add a couple ounces of water. Things that we make often work better when they're wet first. But what other IVs can you take? Well, you can do the Meyer cocktail to get the IV that takes 3, 4, 5 minutes, and all the ACAM doctors will do that, and you go in and you're just getting magnesium and B complex, and it changes many people's lives. But what other IV could you get? Well, you could do that amazing thing of just vitamin C, huge doses, 50, 60, 80, 100. We've had some patients of hepatitis that needed over 200 grams intravenously of vitamin C to bring the titer down on their serious chronic hepatitis. So there's no single answer as to how many IVs are needed. I tend to get everybody to understand that for chelation, I always said try to take 20 to 30 because by that time, 80 to 90% of people will provably have better circulation. So that's answering the question about how many IVs are usually needed. But because we today have been so sick for so long, if you pay attention to my F.I.G.H.T program, you could say, well, gee, Dr. Gordon, is there an IV that would help me with my infection load? Because I've been told I have Lyme, or I have cytomegalic virus, or I have Candida or something. Well, I can do a lot with our silver product, my high-dose A, my special infection program. I can do a lot, but if you really need something at times, the best we have is ozone with ultraviolet blood, used intravenously, sometimes as few as 4, 5, or 6 of these treatments, even as few as 2 a week for 2, 3 weeks, absolutely drops the viral load and all the infection load that we all carry. Now, next question. I've been diagnosed with Hashimoto's. Is there a way to treat it without going on Synthroid? The answer is always yes, but I tell people, when in doubt, please err on the side of taking thyroid supplementation, because I can document to you, really based on top people at Scripps La Jolla who've looked at patients who took thyroid for 20 and 30 years in big doses when the tests never even showed they needed it, but they just felt better. But they wanted to finally say if they could get off of it. And within a couple weeks, the body kicks right in, just like you've never been on thyroid. So it is never something to avoid. When you can get thyroid responsibly prescribed, please take it. But I tend to use Armour or Westroid, which is one that I'm interested in. But I like the natural, and I tend to use it for many reasons. But I want you to know when I use thyroid, I put virtually anybody that has any symptoms that have been related to low thyroid. In Type 2 Hypothyroidism is a book written by Mark Starr. And you buy that book and you will understand that you want to be on thyroid. And it won't usually be Synthroid. I'll settle for Synthroid if that's all the doctor will give you without a fight. but I would prefer to get over to the natural. But the point that we need to talk about in Hashimoto's disease, which you've got an autoimmune disease. So when you understand that I wrote my F.I.G.H.T program as a direct result of reading the book by Donna Jackson Nakazawa, and her name of her book is The Autoimmune Epidemic. And when you read her book, you understand why I wrote and have spent hours putting together lectures on my website, which is gordonresearch.com, hour after hour on food, infection, genetics, heavy metal, hormone toxin, because that's what you have to do if you're going to beat Hashimoto's. You have to treat your body as no different than if you had MS or you had type 1 diabetes. You have to realize that the toxins have to be removed because the body is attacking itself because it sees so many cells that just are so toxic. The body says, that doesn't look like my pancreas, and boom, it's attacking it, and now you have type 1 diabetes. Or that doesn't look like my thyroid, and now you're attacking your thyroid. So try to understand the whole story about iodine and all those. I've tried to lay it out for you. If you don't, obviously, who's got time today? We're all busy. But on my website, I did do a whole hour on food and infection, another hour, another 5 genetics, heavy metals, hormone. So there's an hour with slides to make you knowledgeable how to find which food you need to stop. Because Hashimoto's will always have some food that's contributing and a need for iodine. But when you're in a hurry, just download my 18-page document called Fight for Your Health that Scott Forsgren was so nice to write. It took him 100 hours to summarize what I do. And that will be very, very beneficial for you if you wind up using that as a quick way of getting an overview, because it is pretty difficult. How do you know which food you need to stop? I talked about tests. There's going to be better tests coming out. The test panel that we have today is not perfect, but it's enough to wake you up. But sometimes if you buy the book, A Medical Detective Story by Patrick Carlisle, C-A-R-L-I-S-L-E, is out of London, but he's actually, his name is Patrick Kingston. He's a good friend of mine, and he's a top doctor treating MS in London and England. And he is actually one that tried to teach people how to diagnose for themselves which food is helping kill you. And we've tried to do that. We've talked about a book that talks about your pulse test. And if your pulse goes up more than 10% after you eat a single food, then probably that food has disagreed with you a little bit, but very few people are going to have any problem taking some foods like papaya or rutabaga or beet. Some of those foods are pretty safe. But if I don't fix the reasons that you got the food sensitivity by getting you on the acidophilus and rebuilding your intestine with my program, which I basically am calling my power drink, and if you have the access to it, I would do 1 or 2 colonics with ozone so that I had, and then implanted some good acidophilus in the rectum. So I have a lot of tricks that I do, which I try to describe in the 1-hour sessions that are on gordonresearch.com. And remember, if you are a health professional, all of this is laid out for you much more conveniently by simply joining my F.A.G.H.T, that's my forum on anti-aging and chelation therapy, because when you join that as a health professional, you can put in the word Hashimoto's or autism or breast cancer, prostate cancer, and you can see what I have said. And I've got some 10,000 posts from myself and colleagues that save you having to go to all the conferences I do. You'll have a pretty good overview by simply going to my website and joining gordonresearch.com. But we look at another interesting question. What is your opinion of Pradoxa? Well, clearly it avoids the blood testing that Coumadin, and it's not perhaps quite as toxic as Coumadin. But I tend to tell everybody I don't need drugs that have side effects, because I have found natural products. Now, the advantage of people taking the drugs is, of course, the good government wanting to be sure that they kill the natural product industry, have put just the drugs on the prescription plan. So it's obviously it saves people money to use toxic drugs. But when they really learn what they can learn by going to rxwise.com, and you can put in the drugs that you're taking, and if you're on 5 or more drugs, you will probably die as a direct result of the interaction of the drugs you're taking. So I kind of like the idea, but of course it's expensive. But remember, I said that taking Beyond Chelation Improved alone twice a day, there's no cure there. You have to keep taking it. I don't claim that that's going to reverse the junk on our arteries, because that junk starts by age 21, and so I'm not claiming I can reverse, but I can definitely avoid that fatal heart attack or stroke in most people, because I don't get phone calls at Gordon Research or at Longevity Plus that people have died while taking the 9 pills. If they consistently take it, they're protected. If they run out, within a few days they can be back in danger zone, because remember, I have lots of people who choose to bet their life that I'm right, and they've been told their heart's 80 or 90% blocked on the main artery, which to me means nothing, because if you read everything I've written, only a PET scan says what part of the heart is lacking blood. An angiogram is just a way to sell you heart surgery. So angiogram to me is not where I live and breathe. But since Pradaxa is coming out and it's trying to move into, and it's going to be expensive. Thank heavens we got all the pharmaceutical companies got all their buddies at Congress to pass a bill so that no matter what something costs, you don't have to worry about it. Uncle Sam can buy it for you. But what we're talking about is if you're taking a drug, which is a blood thinner, and your interest is in living a long time, then you need to start to realize, well, what if I have to take that drug, and then over time I have this problem with my gout, or this problem with my diabetes, or this problem with my vision, and I'm putting these drops in my eye. How do all these things start to stack up? So what I try to get people to understand is that when I add another nutrient to my program, I don't have a danger, because I can take my vitamin K2 to prevent the calcification of my arteries, and it will keep my bones stronger. But I have every woman on HRT, herbal remedy from Thailand, to keep the bones strong, and I as a man take it, so I can stack all these things and wind up with what my goal is to live to my maximum intended useful lifespan, enjoying health as optimal as it can be. And that's kind of an important point. I don't want you to ignore small things, because when you ignore a small thing, the next thing you know, you'd stop dancing, or you stop playing golf, or you stop playing tennis. So I try to give people the information, and hopefully more and more of my colleagues will be offering the $20,000 machine, a PEMF, in their office, and the average doctor is charging $3 a minute for a 10-minute treatment. So you get 10-minute treatment. What is the difference to your body? Well, you can only believe that if you watch the PEMF webinars, where I interview these doctors who have PEMF in their office and are treating everything from brain cancer to ALS to autism to Parkinson's to sprained ankles and painful carpal tunnel syndrome and the plantar fasciitis. I mean, there isn't anything that doesn't get better when you bring back the Earth's electromagnetic energy to what it was. Now remember, at the time of the dinosaurs, some long time ago, they say it was at least 30, and it may have been as high as 300, but at least it was a lot higher than the 1 or half 1 or 0.3 that is currently the Gauss level. That Gauss doesn't mean anything to you right now, but remember, I said Mars is a dead planet because it doesn't have the magnet, and the NASA points out that our magnetic field is down now to about 1% of what it was, and that's the reason, not anything to do with Al Gore and the cars, that's the reason that we can't hold the ozone shield around our Earth, because of the collapsing magnetic field. So that really makes it difficult. So now I have my PEMF to add to my F.I.G.H.T, and that makes it really hard. Some people sit there and say, Doc, if it's that hard to stay healthy and feel good, I'll pass, and I'm going to stay on my cigarettes and my Pepsi, and I'll go underground into my grave when my time comes. And certainly that is your free choice. But for those who have a mission they need to accomplish while on this earth, I am here for you to try to give you the information you need to feel as good as I do at the tender age of 76. Hope to hear more questions next week. At least we got 3 this week. I'm looking for more questions, as it makes it much more fun to share with people why I'm doing these things. Remember, they came up with Pradoxin because they wanted to avoid clots. And I'm telling you that they're finally getting a little bit honest, because clots are what kill. Cholesterol is a myth. The number of people dying is a direct result of cholesterol. This is so funny. 1 out of 2 people who die of a heart attack had low or normal cholesterol. 1 out of 2 had high. So it doesn't seem to make any real difference. But of course they've made a lot of money off of it, because they got the government giving everybody statin, and it actually does lower inflammation a little bit, but I would do 10 times more, and I'd have you take one of the really good curcumins. I like Mariva. I like many different things that when I put you on my anti-aging program, you can feel as good as I do. And this is Dr. Gary Gordon signing off till next week, when we'll try to bring in the hormone story and the toxin story and have you really understand that you can fight back, but knowledge is power. Thank you for your attention and participation today. We may wrap you in a sauna, but I want you to have the kind of energy that's possible like this. And we can absolutely use PMF and change your life and change everything so that you can have faster healing, accelerated nerve regeneration. Your mitochondria is the energy in your cells. You have to have energy. That's ATP. This is what's possible. That's my power drink. Fiber Green, Maca, Bioenergy C, Zero Gold. Thank you for your interest, and please take the time. Somebody, Scott Forster, spent 100 hours trying to simplify my Fight for You program. And if you're a health professional, join F.I.G.H.T and know that I even have a whole website on zeolite. In addition to these other websites, we have Zeolite Answer, where you can learn a lot more about the complexities of what is possible in way of getting the toxins. Lead's not the only bad guy. We have flame retardant. We have so many toxins in your body, it's depressing to look at the list, but we can fight back. Thank you for your attention.
Thank you, Dr. Gordon. We encourage you to browse Dr. Gordon's website, which is www.gordonresearch.com. The products that Dr. Gordon has formulated are available through Longevity Plus. Please visit our website at www.longevityplus.com or call 800-580-7587 to place an order. We value all of you, and thank you for joining us today.